So today's presentation is going to be on succinylcholine, which is a paralytic that we use in RSI. So for RSI, we need to be able to control your airway, whether it be for a head bleed, for a respiratory issue, for any type of true problem that we run into that we need to take your airway for. Succinylcholine is a paralytic, which means that when given, you can't, it completely shuts down your ability to breathe for yourself. It shuts down your ability to move your eyes, move your tongue, talk, move any extremity. You're completely paralyzed from, your scalp all the way down to your toes. It's a neuromuscular agent, and it's a neuromuscular blocker that blocks the chemical that goes to the receptor site at your muscle level to allow them to actually fire and move. It is not like rocuronium or vecuronium, so it does not block the sodium-potassium pump, which means that you still have a normal, your muscles are still functioning properly and still living properly, it's just they can't move. Once given succinylcholine, you get what they call a, sorry, I'm blanking out. You get what they call a flexion of the muscles, and that can cause issues if you have broken bones, you have a head injury, you have something along those lines, because it causes all of your muscles to tense up at one time, and you use up all the ACH that is in your body, so that way your muscles can't work anymore. We, as providers, need to think about this more often, because we give it to patients who have broken bones, who have head injuries, who have a lot of issues that this is only making worse. I had a patient 2 days ago that I brought into UHC, and the attending physician gave succinylcholine over rocuronium or vecuronium, and that caused the patient to have become hyperkalemic, which is very bad for head injuries. That being said, the patient did come out okay in the end, but it took a lot of extra medications that was not necessary to stabilize that patient's labs throughout the entire course of his treatment. The only reason EMS did not give sucks or rock in the field was because, due to the state of West Virginia's paramedic protocols, we are not allowed to RSI in the field unless you are an approved agency with 2 ALS providers in the back. It was just me in the back, so I was not able to RSI him, take his airway, and then hyperventilate him. The reason he needed his airway taken and RSI'd is because he did have a massive head injury. So with that massive head injury, one of the major things that we run into and we try to do is hyperventilate the patient, which constricts the blood vessels in the brain. With constricting the blood vessels in the brain, it slows down the bleed, therefore lowering his intracranial pressure and making him not a vegetable in the long run. We need to start thinking about that more as providers, and not just on a paramedic level, but we need to push on the physician level also. If you run into the run a call into the ER, and they're going to give your patient succinylcholine and they have a head injury, they have broken bones, they have burns. Burns is another bad one that we run into, because they're already hyperkalemic, and then you're going to make them even more hyperkalemic, which can cause cardiac dysrhythmias and a bunch of other problems. If we see that, we need to, make sure the physician is aware of what he is doing and not just doing it out of habit or because that is the normal way that he likes to do things. It needs to be going by protocol and remind him of the potential hazards that you run into with giving succinylcholine. That's pretty much my entire presentation. Do we have any questions? Anybody?
So say you're in the field, you have someone roll a car 2 or 3 times, they're trapped inside of it. You get to the scene, you have no clue. Like they have no clue where they're at or who they are. What are you doing?
So the first thing we're going to do is we're going to push a whole lot of fentanyl or ketamine or Versed, some type of either pain management med or a benzodiazepine, a sedative, to knock them down, make them calm. And you actually have, before you ever push a paralytic, you have to push some type of sedative or a pain med or something like that to kind of help them mentally adjust to what's about to happen to them. Then you would push your paralytic, whether that be succinylcholine, rocuronium, or vecuronium, and then you would intubate the patient and secure their airway and start hyperventilating them. Preferably, you would like to also have mannitol 3% on board, and you want to elevate their head at 30 degrees. Other than, surgery, that is going to be your best route to take for a head injury patient.